welcome to the next episode of The Doc is In. My name is Dr. Stephanie Ricci. I'm a gynecologic oncologist at Cleveland Clinic Abu Dhabi. Joined with me today is Dr. Sozdar Abed. She is our new gynecologist and minimally invasive surgeon, who we are very excited to have. Today we're going to be talking about cervical cancer screening, and the HPV virus. So Dr. Sozdar, as you know, our patients are very oftentimes confused about what the cause of cervical cancer is and what the HPV virus is. So when you have a patient who comes to you and wants to know, why am I being screened for cervical cancer? What does that mean? Why do I have the HPV virus? How do you start addressing some of those questions?
Okay, good morning, and thank you for having me. I do educate my patients about cervical cancer screening, very important tool, and 90% of cases are associated with HPV virus. And it's such an important screening tool to perform the pap smear, which is the cervical cancer screening, in addition to the HPV testing.
Yeah, exactly. There are, as we know, two components to the cervical cancer screening. So there is the pap test, which, scrapes the cells from the cervix, and a cytologist, or this is a doctor who specializes in looking at cells under a microscope, looks at these cells under the microscope. And then the second part of the screening test is the HPV test. And I think a lot of women get very confused and embarrassed about testing positive for the HPV virus. And as you said, HPV is very common and prevalent in adults who are sexually active because it's an asymptomatic virus. Men and women don't know they have it, and so they pass it back and forth just through either genital touching or, like you said, oral contact. It's very easy to get this virus, and nobody ever knows that they have it, so they don't know that they are passing it to another individual. So if a woman comes to you and has a cervical cancer screening test, the pap test with the HPV test, and they test positive, meaning what does that mean, and kind of what can they expect as their next step?
I agree, the two components now are standard part of the screening. I do discuss with the patients, we look at both components. So if there are abnormal cells on the pap test itself, which I explain to the patient is the scraping of the cells on the outside of the cervix and the inner part of the cervix, in addition to the HPV testing. If it's positive, it depends also what types are positive. Luckily, we have further screening now for the HPV types, and I do explain to them that there are certain types are more frequently associated with cervical cancer cases. So it depends on really on the pap component and the HPV component and what type HPV. Then we discuss the next step. It depends also, guidelines recently changed about the risk of the patient. I not only look at the pap and the HPV, I look at the previous history of abnormal pap smears, in addition to what they're presenting with, because pap test and HPV screening guidelines are something we follow. At the same time, if someone comes in with a problem, abnormal bleeding, bleeding after intercourse, a long history of persistent abnormal pap smears, if they have immune deficiency problems like HIV, or they are on immune suppression medications, then we adjust these guidelines, and we change what the next step is, and make it more individualized than just following the table
Yeah.
of the guideline.
I think it's so important for women to know that, as you so nicely said, pap smears are not a one and done test. It's not just you can get screened for cervical cancer once and then your risk is none for the rest of your life, right? You need to get regular screening, and the screening is based on your history and your medical history, and the test result. So if you are HPV negative and your cytology, meaning the cells, are also negative, and you have a history of always having negative pap smears, then the new guidelines say you can go up to 5 years without needing another pap smear. But if you are HPV positive, you will need something called a colposcopy. And we'll discuss that in a moment, but that will also increase the amount of screening that you need to have in the future. So let's talk a little bit about in the event of either a positive pap smear, meaning the cells are abnormal, or you test HPV positive for what we call a high risk strand, because there are high risk and low risk strands.
Yes.
So a woman would need to have something called a colposcopy, right? Because the pap smear and the HPV test is the screening test, and the colposcopy is the diagnostic test. So let's talk a little bit about what a colposcopy is and what a woman can expect at a colposcopy appointment if she has to have one.
Colposcopies are usually in-office procedures. Most patients do not need anesthesia to get a colposcopy. I do explain to my patients that it's basically a magnifying tool to look closer at the cervix, and we use certain solutions to actually enhance any abnormalities that we cannot see just in without the microscope. So using these solution in addition to the microscope and different lighting that's also available in the colposcopy machine, it helps me look closer to the cervix. If I identify anything abnormal, visibly abnormal, then that helps me to guide a biopsy. A biopsy is a little different than the pap smear cytology. The pap smear cytology provide some information, but it's more cells.
Right.
However, seeing something abnormal and taking a biopsy is more um, uh, a better, let me say, a better tissue sample to send to pathology and identify further abnormalities.
Yeah.
So biopsy is really used during the colposcopy. I also counsel them that there is scraping done from the inner part of the cervix to assess different cells. I do educate them that there are two different cells on the cervix itself.
Yeah.
And sometimes we do recommend both, either the colposcopy with the inner scraping as well as biopsies if visibly there are abnormal uh, um, changes.
Yeah. Yeah. So basically, you have a screening test, which is the pap smear and the HPV test. That's step one. If you screen positive, you undergo something called a colposcopy, which, as you said, is done in the doctor's office. It's not a painful procedure. A lot of
Yes.
women are worried that it's going to be painful, and I tell them, no, I'm just looking. And even if I have to take a biopsy, it's not something you're going to really feel because we're just taking a very superficial collection of cells. And then, if on the colposcopy, if the biopsy or the scraping of the inner portion of the cervix, if any of those are positive for what we call cervical dysplasia, meaning precancerous cells, then the next step is an excisional procedure. And that's either a cone biopsy or a LEEP. And that is a procedure where we remove, up to a centimeter of the very external portion of the cervix to send for pathology. And the goal with that is diagnostic, right? Getting more tissue, but also hopefully treatment and removing the abnormal cells that we can see. A lot of women are also concerned. They may not even have any cervical dysplasia, but they are positive for the high-risk HPV virus, and they're worried that they're going to get cervical cancer. So what do you say to those patients who are positive for HPV, maybe have some dysplasia, maybe don't, but are concerned about getting cervical cancer?
I do discuss with patient. I first try to reassure them as much as possible.
Yeah.
Reassure them at the same time, emphasize the importance of continuing to follow up. So if the cytology part, the pap smear is negative or it's mildly abnormal, the HPV is positive, depends also on the strands. If it's a higher risk, more
Mm-hmm.
frequently associated with cervical cancer cases, then we do schedule a closer follow-up to reassess the cells, And especially in if the colposcopy evaluation was negative,
Yeah.
then I reassure them that so far the evaluation does not show a moderate or higher risk lesion or dysplasia or precancer case. So we do follow up closer for those patients. So we also discussed the HPV virus itself. Women are worried that this is a sexually transmitted virus. I
Yes.
do explain to them it's different than other sexually transmitted infections like HIV, other vaginal or cervical infections like chlamydia, gonorrhea, trichomonas. I do name them to say those we do treat you, treat your partner. We retest you in some cases to make sure you got rid of it. With the HPV virus, we do not have a pill or an injection or a solution or a vaginal cream or a gel to really get rid of the HPV virus. And I do tell them that HPV is very common. Men and women carry it. I tell them, even some studies showed that providers, physicians carry it mostly on their hands. And same thing, face, nose, mouth. And I do tell them, even though it's sexually transmitted, almost everyone has it now.
Yeah.
We don't know what types, but almost everyone has HPV. And just to, I do counsel them that there are some factors that make HPV persist longer. Some of it is some factors we can modify, like smoking, living healthy and eating healthy. So boosting the immune system, and recommend to stop smoking. Um,
What about vaccination? Because I have a lot of patients who come to me and ask about vaccination. And here in Abu Dhabi, there has been a campaign to start vaccinating young women in the schools from the ages of 9 to 13, which is the ideal time to receive the HPV vaccine. So that's just an excellent, excellent campaign for women's health here in this country. Um, but there are a lot of women who did not receive it in school and who are a little older in their 20s, 30s. And are interested in vaccination or maybe don't even know about it, but are coming who are HPV positive. And so I take it that as an opportunity to counsel them and vaccinate them. But what is your practice as far as HPV vaccination?
I absolutely include that actually for every GYN visit. It doesn't matter if the patient there for cervical cancer screening, a wall woman, a birth control visit. I do include HPV virus because since it's not something we can treat
Hmm.
with antibiotics or other medications, I do recommend the vaccine to prevent it. It is pretty effective. I do counsel my patients that it does decrease risk of oral, genital in men and women cancers down up to 95 to 98%, depends on the cancer type. I do explain to them that it has been developed over years.
Yeah.
Uh, Currently, it covers 9 of these HPV strands and those higher risk ones. So I do counsel them that ideally you would want to get the vaccine before being exposed or getting exposed to the HPV virus. And it is approved per the guidelines between the age 11 and 12. How that's the ideal window, 11 to 12 for women, but it can be given starting at age 9 for males and females. However, if they've missed that window and they're already sexually active, even if they test positive for HPV, even if they do have some abnormal cells or dysplasia or precancer cells, studies have showed that there is some benefit to the HPV vaccine because
Absolutely.
it will cover some of the strands that are not involved, may not be involved in the type they have.
Yeah.
So it's worth to receive it.
I
Um,
agree. And in the US, the FDA has approved it up to the age of 45. And
yes,
so
yes,
insurance here will cover it up to the age of
yes,
45, which is excellent.
yes,
And as you said, there was one particular amazing study that was done looking at women who had CIN2 with
yes,
a,
yes,
which is a level 2 pre-cancer cells, who then had a leap.
yes.
So they, removed the bad cells, and then they vaccinated them after the LEAP procedure, and it reduced the chance of the CIN2 returning in up to 70% of those women.
Yes.
So so these are women who have HPV, who have cervical dysplasia, who then got treatment and received the vaccine. And the vaccine is for prevention. It's not for treatment, that we know of so far, but it actually showed that it probably does have some efficacy in women who are already HPV positive, in allowing their immune system to help
Yes.
suppress the virus.
Yes. Yeah, that's exactly the study I was referring to, specifically the
Yeah,
CIN2 or moderate precancer
exactly.
cells.
Yeah,
Yes. Yes.
yeah. So basically, you offer vaccination to any women pretty much up into the age of 45 who come to your clinic.
Absolutely. And it's great that it was approved. Initially it was up to age 26. Now it's approved to age 45. So I definitely encourage all my patients to think about it. I do counsel them like any other vaccine, being slightly tired, having a low-grade fever, soreness after the vaccination, but the benefits of it is outweigh those risks.
I tend not to give it to patients who are pregnant because I
Yes.
think it's not approved for that population. Um, but I believe we can give it to women who are breastfeeding. I think that's an okay indication.
Yes, I agree. Yes.
Um, so really, just other than pregnant women, that's kind of the only contraindication for the vaccination. Um, so I think that the important thing for our patients to know is, when we screen for cervical cancer, it doesn't mean you have cervical cancer or that there's something wrong. We're just doing a screening test to make sure that there isn't something wrong. If you test positive for HPV, it does not mean you're going to get cervical cancer. In fact, most women who are HPV positive won't ever get cervical cancer. Your body will naturally take care of the virus and stop the transformation that it can have in good cells into bad cells. But we need to monitor you more closely because you're at higher risk for developing cervical cancer if you are HPV positive. The HPV virus is not something that you need to be ashamed of having because pretty much everybody has it. So it's nothing to worry about or lose sleep over. And if you do have the HPV virus and you develop some precancerous cells, there are treatments available so that you never develop cervical cancer. Cervical cancer is absolutely a preventable disease in almost all cases. And for women to have the education to know how they can prevent, from developing this terrible disease is I think really important.
Yes. Yes. I do want to just add that during during the patient visit, I do ask some patients, have you had a pap smear? And some do not know.
Yeah,
A lot actually do not know when they present to a GYN office and they have pelvic exams, they think a pap was done. They
correct,
assume it was done.
correct,
And I do explain to them that there are different swabs we do. Pap smear testing is one of them. That same swab we do send for the pap and HPV testing. And
but both those
other,
tests are not always ordered
right,
because you can order
right,
a PAP without the
without
HPV
the
or vice
HPV.
versa. Yeah,
Yes, yes, yes. So it depends on the patient's age. Typically, guidelines do say up to age 30, just the pap smear testing, even though I think studies are showing that the HPV is going to become one day the screening method
correct.
for cervical cancer. But yes, the guidelines do say to perform with the HPV testing at age 30 and older. Before that, we just do the pap testing. But what I was trying to say, it's the same brush. You could send for both. It doesn't
Correct.
have to be two separate swabs. Any other swabs done, they do not mean you did the pap test. It's a certain brush used for that. So some other swabs we do test for other infections. Um,
Right. So a woman could have had a pelvic exam, even, with a speculum inserted, but
yes,
maybe not had a pap smear.
yes, yes.
Exactly.
Yes, yes. So not every speculum exam and a pelvic exam means they had pap smear. And screening does start at age 21. It depends on cultural, religious restrictions. Some patients do not start at age of 21, and we do counsel patients. It is recommended to start at age 21. However, it can be started when women are sexually active.
Right. Well, thank you so much, Dr.
Thank
Sozdar, for
you.
joining me. This
Thank
has been
you.
a wonderful session. Thank
Thank
you.
you. Thank you.